Hey, good morning, everybody. We're going to begin with a meeting. First of all, some important messages. We have simultaneous interpretation in the four languages of the organization. So each of the speakers will be able to speak in the language that you feel the most comfortable. So as an audience, you could please pick at the bottom of your Zoom menu what is the language that you feel better with. Hopefully native language. I am Mirna Marti. I work as a regional consultant for information systems in the information systems unit for PAHO. And giving this opening of this meeting with special greetings from Marcelo D'Agostino, our unit director, who is unavailable during these days for his vacation, although he's been working all throughout the development of these guidelines. So good morning again. Today we're meeting during this online forum to focus a bit on the vital statistics system and its implementation in the CIE-11 in the Americas region with special attention, of course, with the acceleration of digital transformation of these systems. So it's of the interest of our unit and PAHO as well. It is key then to work together and give support to the moving forward CIE-11 in the region and take opportunity in these vital statistics. It is also important to thank everybody and all the national counterparties of the National Institutes of Health, Statistic Institute, Civil Registration, and institutions of the sort that are represented today with us. I see that we have 60 participants, 60 people who are interested in this activity. Also, the international agencies that are collaborating in everything that has to do with civil registration and vital statistics in the region, and particularly the rural philanthropy that gave support to all this progress on that it would have otherwise been very difficult to achieve without their support. In this activity, we have with us the team of Information Systems for Healthcare from PAHO, digital health, that works together in all the work being done in the area, which is a whole lot more than what we're sharing today. But it is possible thanks to a group of colleagues that is fully dedicated to this. Catherine Conchu, Andrea Greger, Carlos Otero, Charlie Miki, Javier Vargas, Victor Alvarez, Maria Lidia Diaz, and the support of Miriam Caracolia and Elise Cotter. Thank you all. And I must also stress out the focal points of our country offices to make technical cooperation of PAHO possible where the countries need it the most. Some important elements for the meeting. We're going to share key results of the pilot study on the preparation for the CIE-11 in the region. We're going to hear about the results, or at least some insights now that we have the interagency meeting we held together in Trinidad and Tobago to start with a roadmap for the Caribbean, where they speak English, and some findings of the pilot project in Suriname as well. We'll also share a video And hopefully we'll have a space to answer some questions if anybody has them. Without further ado, and expecting for this meeting to be very productive, I'm going to hand it over now to Katri Conti, who is the international consultant in information systems and digital information systems in healthcare and the unit of information systems of PAHO. Katri, you can go ahead and share your screen and start your presentation.
I will speak English. I'm more comfortable to presenting English, although I try to learn my Spanish or improve my Spanish all the time. But since we have a translation service, I will present in English. So my name is Katri Conti. I'm working with the Mirna and the rest of our team in Washington, D.C., and I will present a pilot study that we did to look the preparedness status for the ICD-11 implementation across the Americas. So ICD-11, as you all know, is the digital first classification, new version of the ICD. Following the ICD-10, it has more than 55,000 diagnostic codes, and it has the ability to do the post coordination, which means that you can expand, the codes over 2 million different code combinations. It supports all the digital tools, electronic health record integration. It's multilingual, and it supports the interoperability of the health systems. I would like to know that there's no country in the world at the moment that has introduced both morbidity and mortality coding at the national level. So most of the world is still preparing for the full implementation. And our study goal is to assess the PAHO's ICD ERA tool, which is ICD readiness assessment tool for the ICD-11. And I just want to highlight that the tool is not meant to compare the countries. It's not the benchmarking tool. It's the mainly tool for the national planning and the help with the dialogue and prepare the roadmap for the countries. However, since we tested the questionnaire in the, 17 countries, it will provide a nice snapshot of the regional progress, which I would like to share with you. So we used a mixed method study methods. We collected the data from the October 2024 and March 2025 with the Google Forms. The tool assesses leadership, financing, operation, workforce. It's a structured survey, and it has 2 open-ended responses. And as I mentioned, 17 countries and territories responded. And readiness scale is a Likert scale. The number 1 selected, it's not started, there's no significant actions. Number 2, the selected would be the activities are in progress. And number 3 is more advanced implementation. Most components are in place, but there's still minor improvements needed. And number 4 would be full ready, that the country is ready to start scaling up ICD-11 at the national level. We validated the tool, the couple of the workshop. We calculated also the validity and reliability, the index with the statistical Comprach alpha, which showed the good validity of the tool, which means that it measures what it's supposed to measure. And the tool is based on academic literature review and existing tools. So the first, the model that we looked was the leadership and governance, and it's at the moderate level among those 17 countries that we measured. The average score is a 3 out of the 4, which means and roughly 75% readiness. Most countries have identified champions for the ICD adoption, which is great, but there is a still gap of in terms of the formal planning. So they might have the roadmaps, but they are not endorsed at the national level. Senior management awareness is moderate. There's still room for the improvement in understanding the full scope and impact of the ICD-11. This means that the senior management knows what the ICD-11 is. They know that, its implementation and requirements, but they might not have exactly the enough information about the costing and how it will be implemented. Some countries have ownership structures, but the formal governance frameworks need further development for more effective coordination. We have seen that there's a lot of ICD-11 task forces that has been established, that working committees, or it's been integrated for the existing committees, such as the mortality surveillance committees. However, it might be that there's some crucial stakeholders are not still included. For instance, we have seen that the digital health is not always not included in these committees, and it would be highly crucial to have the digital health colleagues and IT for the planning because ICD-11 works the best when it's integrated in the digital environment. Countries reported the strong institutional support for the ICD and data standards, with the many countries already have nominated focal points for the ICD-11 coordination, which is a great. All the 17 countries are reported to have the ICD-11 focal point. Strategy and financial readiness. I was surprised that, actually the score is quite high. It's a 3 out of the 4, which means 75% readiness. Although the 17 countries report no funding for the ICD-11. However, I think that the score, because it's not weighted, those indicators, it's high because the 42% are still in the discussion about the sustainable funding, but this would mean that they would have scored the 2 at least because the discussion already have started. One of the evident result was that ICD is not fully integrated into most digital health strategies, which is a huge gap. And that would be a recommendation that the ICD-11 would be part of the digital health strategies and policies, and mentions all the interoperability plans because it's not a standalone project. Is a data standard that should be integrated, for the other health information system plans. So the key recommendation would be to highlight really the funding gap, since without no funds, there's no implementation, and integrate ICD into digital health strategies and try to develop a sustainable funding models. Then the fourth, the model we looked operational readiness. And the key insights are that 67 of the respondents countries view ICD implementation as very or somewhat challenging. And 71 have draft transition plans or partial implementation, as mentioned earlier. And 65% consider 2 or 3 years a realistic timeline for the transition. However, I would like to mention that only 5 out of 17 responding countries have actually reported mortality and morbidity pilots using ICD tools, but there's significantly more higher level, 59%, that have at least, the advanced planning. And the key recommendation is expand the pilots. If you have a pilots, expand them. Focus on documenting results to scale. Try to tackle technical challenges, which means upgrade health information systems or do at least, due diligence assessment. Look how your current system can integrate with the ICD-11 and enhance workforce capacity. Invest in training for the technical staff. And the average score, score 2.63, around 66% of readiness, suggests that the file operation readiness is progressing. Many countries are still in the early stage of implementing ICD-11. And I would like to highlight the importance to have the pilots in the real-world healthcare settings, and because this is the only way that you could actually collect the feedback from the end users and document potential challenges and do the course corrections before trying to scaling up the ICD-11 in other the health facilities and other areas. The last domain that we look was the human resources and training. 18 of the countries, which is 3 in the crude numbers, have no training for the ICD-11 personnel. The good news is that at least 41% of 7 countries have basic training, and the 5 reported formal training in place, and 4 have integrated training already at the national level for the ICD-11. However, we just still can say that over the half of the countries still need improved training. We need hands-on tailored training for different end users, including the IT and digital health. And the recommendation, therefore, is expand the training to include hands-on tailored training in various end users, not only for the coders, but also the doctors, administrations, and IT and digital health, and focus on integrating ICD training into daily workflows or the use. And this is the best way to learn through the pilots. So summary of the key findings is that the regional average score across the models is 2.83, around 71%, indicating that in average regions in early to middle stages of readiness across the models, with room of improvement is specifically in operational and workforce readiness. And the last slide, I would like to just share some tentative recommendations for the countries that came from the study. Is the first to formalize ICD transition plans. This ensure the leadership and that adequate resources are allocated, and emphasis on cross-department coordination, multi-agency task force. ICD implementation is very different than implementing ICD-10 because it's ideally is integrated with the digital environment, and therefore you have to expand coordination with the digital health and IT, and not only focus on statistical part of the ICD-11. Expand hands-on training, as I mentioned earlier. Strengthen health data teams. This came out from the IS4H evaluations as well. Countries lack health data and terminology teams, and it would be important to build these teams, ensuring IT and digital teams are part of the ICD task force, as mentioned earlier. Leverage pilot projects, scale and document projects, secure sustainable funding. And here I could say that the best way to sustain funding the ICD-11 is to integrate ICD into existing digitalization projects. If you have reform or the new EMR system the coming to your countries, you are implementing a DHS2 or you are digitalizing the health registries. As part of these, the bigger pilots or the reforms, if you integrate the ICD-11 as a part of the one of the requirement, it would be automatically funded. And as I mentioned, ICD works best when it's integrated in the existing systems and architectures, since it's a data standard, not a standalone project. And lastly, conduct readiness and feasibility analysis for the ICD implementation. Initial readiness assessment, such as the 17 countries have done, which is not measuring the implementation maturity, which should be done the later when the country has started the ICD-11 implementation. And that could be done to formulate and decide different use cases. Also, there should be the technical assessments for the software tools and digital environment, current coding and data standard practices to have the full understanding how the ICD feasibility and implementation would work in a country. So thank you so much. Lastly, I would like to say the thank you for all the country focal points and 17 countries that participated. Based on these results, we are refining the tool, and in the end, we would like to share it with the rest of the region. Thank you.
Thanks a lot, Katri. A lot of very valuable information for the next steps. So I'm Andrea Geiger. I'm a specialist of information also in the digital information systems here in Washington. And first of all, we have a very tight schedule. So if you have any questions, I dare suggest to write it in the Q&A section, and then we'll be able to answer during the meeting. And if we have time, then at the end of the meeting, we'll be able to answer them. Then the next thing is we have found several informational videos to bring awareness on CI11 and the tools that facilitate communication and interoperability. We also want to thank our partners, Number Philanthropies and Bachelor Stretches. Thanks a lot. And next, we'll show you one of the 5 videos we've done. This is about the web version of Doris. As you know, this is an acronym. It is a tool, uh, uh, of a software to help in the automation in the selection of the basic cause of death, and it was developed by the WHO, and it is a digital good for public health. It is needed to clarify that the web version is intended for the individual processing of certificates, while for the coding by lots, a there's a need of the desk version. So we have 2 videos on the desk version, but also in the ICD of these ICD-11 in general, and another one about the importance of the mortality quality data. I need to tell you that right now we are finishing the interpretation, the translations to all the languages, to 3 languages, and but we're going to see the Doris version in English. Go ahead, Marina. Thank you.
Welcome to this brief tutorial video on DORIS, the Digital Open Rule Integrated Cause of Death Selection Tool, designed to automate the selection of the underlying cause of death from the information provided on the medical certificate of cause of death. The underlying cause of death is the disease or injury which initiated the train of morbid events leading directly to death, or the circumstances of the accident or violence which produced the fatal injury. When diseases or injuries result in a death and are reported on a medical certificate of cause of death, DORIS can be used to select the underlying cause of death for routine single-cause tabulation of mortality statistics, which is used for decision-making, policy, and planning. DORIS is available in 3 different versions: web version, desktop version, and API. In this tutorial video, we will explore the DORIS web version, which you can access from the DORIS homepage or via this link. To select your language, click the language key on the upper right-hand corner of the page. When you access the DORIS web-based application, you will find an electronic version of the International Medical Certificate of Cause of Death form, which includes administrative data, medical data in Frame A, and additional medical data. There is a section to report fetal or infant deaths and information on pregnancy. Using this example medical certificate of cause of death, we will practice using the DORIS web-based application. In the administrative data section, enter the sex and age either by noting date of birth and date of death, or by stating the estimated age. Do not forget to select the age unit when reporting estimated age. In the medical data section of Frame A, enter the medical term or ICD-11 code. The web-based application is linked to the ICD-11 coding tool, allowing you to either enter the medical term to select the appropriate ICD-11 code or input the ICD-11 code directly. You can see in this example the correct spelling is important. For detailed medical terms, post-coordination may be needed. Start by entering the STEM medical term. Click on the post-coordination icon to select the additional detail for post-coordination. Once you complete your post-coordination, click on Select for the post-coordinated code to be entered into the DORIS web-based application. After entering all information from the medical certificate of cause of death onto the DORIS web-based application, including reported details on external causes, surgery, autopsy, fetal or infant deaths, and pregnancy, click Process. DORIS will apply ICD-11 rules and select the underlying cause of death, which it will present in a detailed report in the output section. The output may include the underlying cause of death with post-coordinated information if that is applicable based on the information reported on the medical certificate of cause of death. The DORIS web-based application also provides a short and full coding report presenting details of the ICD-11 rules applied for the selection of the underlying cause of death. This output allows mortality coders to review the application of ICD-11 rules and have more control over the mortality coding process. Additionally, the output can be used to train mortality coders on ICD-11 rules. Once the underlying cause of death is generated, you will need to manually enter it onto the hard copy version of the medical certificate of cause of death or database, whatever your data management process might be. Keep in mind that the DORIS web-based application does not store data. Clear contents of the DORIS web-based application before moving on to the next medical certificate of cause of death. The DORIS web version can only be used for the processing of individual medical certificates of cause of death. For batch processing, you will need to use the DORIS desktop version. For more information on DORIS and the DORIS web version, visit the DORIS homepage. It has general information and access to the web version, desktop version, and API.
So that was a Dory's video. We're still polishing up some others, and we'll let you know when we have them ready to be distributed. Now we go with Katri. She's going to introduce to us the summary of the partners meeting we just had and an interagency meeting in Trinidad and Tobago that we had in March in order to discuss a roadmap that is interagency and clear. As a next step in this meeting, we're also going to show the roadmap to the Caribbean countries so that they can validate the proposal for the next in-person meeting that we have scheduled. Katri, go ahead.
Thank you, Andrea. It's me again. I'm just going to present quickly our workshop that we had in the end of the March 27 and 28, to be specific, in a port of Spain in Trinidad and Tobago. The objective of the meeting was to continue the collaboration with the technical agencies that started in 2022 when we had a first interagency meeting with the technical partner agencies. You can see all the logos on the slide. We have multiple partners. We had 13 technical agencies in this time, and we have expanded the members since 2022. So here we go. There are the few pictures from the meeting that we had. And just to go quickly through the background, why we had these, specifically now focusing on the Caribbean. Because the interagency collaboration, we covered the whole region of the Americas, but this time we wanted to specifically focus on the CARICOM countries and affiliated states in the Caribbean. Because we haven't really collaborated and look, in terms of the technical agencies, how we can support the countries and small island states together and pull our resources together. And we all agree that, with the current situation in the world, the reducing funding for the international collaboration, interagency collaboration, and collaboration agencies together with the countries is even more important. And we wanted to use the digital ICD-11 as a like a Trojan horse, to not only to improve, obviously data quality of the coded data, but to look, the whole digitalization of the civil registration and vital statistic processes. PAHO, we are promoting digital transformation and focusing integration ICD-11 adoption, but we have a lot of other partner agencies that works also with the digitalization for the Ministry of Justice databases and registrars, and other agencies that are focusing specifically, for instance, the birth notifications processes. We think the integrated, coordinated approach is crucial. And in the end, we wanted, the outcome of this workshop is a roadmap just to develop with all the stakeholders together and technical agencies. And we would like to then to open the dialogue, with the member states and territories to finalize together and like a co-develop and co-design this roadmap. So situation analysis in the Caribbean is very similar than in elsewhere. Key challenges are inefficiencies in processes under registration, which is actually quite minimal, but the data quality is a big problem. Resource constraints is a big thing for the small island settings that came through, also with the ICD-11 readiness study that the human resources are the biggest obstacle because when you train, the couple of people and when they leave, you go back to zero basically. Governance and legal frameworks, where the few issues as well, especially the old legislations, do not necessarily allow for the digitalization for the birth and death certificates, and therefore they need to be revised and potentially changed. There's the infrastructure challenges, data use culture, obviously funding, which is a universal issue. Some cultural factors and socioeconomic barriers. But there are a lot of opportunities, and we wanted to focus digitalization strategies and specifically in reforms that are ongoing. There are many the big digitalization efforts across the Caribbean. Governments are very keen to provide e-services for their populations, and that comes that they would require also the digitalization of the civil registration and vital statistics in order to digitalize the other government other government services. And opportunities and legal modernization. We will have a project with the Global Advocacy Incubator under the Bloomberg Grant and collaborating with them to support the countries to modernize the legal frameworks. We work a lot with other agencies such as CARFA with the capacity building and data utilization. And as I mentioned, we using ICD as a catalyst, to re-engage the discussion, the modernization of the entire end-to-end mortality surveillance systems and birth notification. And our roadmap development have a key areas that we wanted to focus, as I mentioned. The one was a governance and legal framework. We have identified that this is a very big issue. Some of the legislations in the Caribbean, they derive from the Victorian England era. Finance and resources is a one issue that we would like to support the countries to identify, where we could find the finance and resources for the civil registration and statistics, human resources capacity, capacity building, automated tools, infrastructure. this is particularly true how we can embed, for instance, birth and death digital notification systems and ICD implementation as part of the bigger health reforms in the countries, such as, the big electronic health record modernization projects, data quality and data use, which is obviously part with the ICD-11 implementation. And ultimately, we would like to support with all of these, the service delivery, whether it would be the better the health data, or to have the ability and provision for the citizens to receive the digital birth and notification certificates in the countries. And the next steps, we had a meeting and now we are doing the first draft, which we would like to review with all the partner agencies that that came to the meeting and are part of the collaboration. And then we are doing the final version. We want to validate with the countries and kind of co-design, if they have, any important feedback that they would like to integrate. This would be the third step, and then we would like to go for the implementation. And that's the end of the presentation. If any questions, please, you can contact us. And as I said, we will share, the final roadmap, when it's approved by the countries. Thank you.
Thanks a lot, Katri. And well, now we're going to introduce Rosamund Adams, our focal point in PAHO for this particular and many more elements in Suriname. And he's going to share with us about a specific collaboration we have been working together with. So go ahead, Rosamund.
So let me first start by saying thanks for giving Suriname the opportunity to present on the digital mortality registration system, and particularly the digital death certificate that we have launched in Suriname. I will present on some of the challenges that we've had in terms of moving from the paper-based system to the electronic system, but also some of the factors that have pushed and have favored the transition and the move. So I'll start by saying that, let's see. Okay, yes. So I'll start by saying that it is very important that we collect accurate mortality data, and even the people in the Ministry of Health that we work with, at times we have to remind them that accurate mortality data is just not records that we collect and we sit on. They're very critical for the public health work that we do, and they serve as a compass for guiding health priorities. They do help us in showing the burden of diseases, and they do measure the true impact of public health interventions so that we're able to see if there is an increase or a decrease in mortality due to interventions that have been implemented. And so without accurate mortality data, health policies become a lot of time reactive instead of being strategic, and we often find ourselves having to respond in a reactive manner to respond to these public health situations. And secondly, resources can be misdirected if we don't have proper mortality data to guide our public health interventions. So in the case of Suriname, we've had political commitment, and this is very important in terms of the digital transformation of the health sector. There have been political commitment from the highest order, from the president, from the directorate of the Ministry of Health, to guide this process. Not only is there political commitment, but there have also been political action, because there can be political commitment, as you know, without political action. So there's been political commitment, and there have also been political action. And very importantly is that there have been a roadmap to support the digital transformation agenda. As you can see, there's an agenda for the digital transformation of the health sector, Agenda 2030, and this is literally the blueprint that that supports all of the digital transformation work that we have been doing, PAHO WHO, with the Ministry of Health and other stakeholders. And also, there is also a multi-stakeholder collaboration in which not only is the Ministry of Health, not only PAHO, but other stakeholders such as the Inter-American Development Bank, RIVM, and other key stakeholders, the Caribbean Public Health Agency, CARFA, we've all been working together in pushing for the digital transformation and for the implementation of this roadmap for Suriname. And so the establishment of the electronic medical records is one of the key highlights in the digital transformation activities. We have also piloted telehealth in remote communities in Suriname, and we have also supported the implementation of the electronic death certificate, which I will speak to a bit more moving forward. But just to say, I think in Catherine's presentation, when he spoke about governance and leadership, that Suriname has a dedicated IS4H committee, and this IS4H committee has been installed by the president, and so there is very strong governance and leadership that is helping to accelerate the digital transformation agenda and the implementation of this roadmap. So when we look at the death certificate in Suriname, there were quite a number of challenges with the death certificate and with mortality data. The last official publication of mortality data in Suriname was more than 10 years ago, and the ICD-10 was used for coding. There were limited human resources with people who have been trained in ICD-10. The impact of people retiring, of people migrating, and so it left very little human resources capacity to support the process. When it comes to data analysis, there was limited human resources to support the process, and the certificate was only paper-based, and as you know, it was an old system, old paper-based. The Form C of this death certificate was last reviewed in 1956, and so it does not meet the current requirements. There is no collection of data such as maternal data or anything. It was just a basic death certificate, and so there was really the need to support the country in moving from this paper-based system, moving from this old death certificate to a more modernized one, which will allow us to capture the important data and able to ensure that we strengthen civil registration to get vital statistics in Suriname. Also, the legislation that supported this was very old, and so we also work with the Ministry of Health to support legislative changes in the adoption of the digital certificate. So what did we do? The Ministry of Health, through support of PAHO and other agencies, supporting the hiring of ICD-10 coding experts so that they could have looked at outstanding mortality data that required coding. There was a huge backlog of data that needed to be coded. We collaborated with the university, and again, this is where multi-stakeholder collaboration is important. When the Ministry of Health cannot do it by themselves, the Bureau of Public Health also, and so it's important that, you know, we collaborate with other stakeholders. And so we collaborated with the university in supporting the data analysis process. We pushed for an improvement in data collection and data analysis, by adopting the WHO death certificate, supporting and pushing for change in legislation to support the electronic death certificate. And also, this helped us in reducing delays in reporting by ensuring that that the data that was captured, data that was analyzed and used, was connected with ICD-11. We also supported the training in the use of ICD-11, and we're also supporting the country in the transition moving from ICD-10 to ICD-11. In terms of what the death certificate looked like, if you look on the left, that was a previous paper-based death certificate. And so if you look on the right, this is the new digital interface, just showing you a comparison and seeing, what we've moved from to something that is very common and usable, because we're now in the era of screens, of clicking and so on. And so it is a more user-friendly interface where the physicians, the coders, all they have to do is click and be able to enter the information. And it is also, as I said, linked to ICD-11. So if you look all the way to the right lower side of the screen, you can also put in the search bar what exactly you're looking for, and then you get all of the options to choose from the right selection. In terms of data flow, this is something also that was very critical in the development of the new electronic death certificate. Previously, when there was everything was done manually. So 2 forms were completed. Form A was completed by the physician, and the family gets this, and the family has to take this to the civil registry, and then the civil registry will then issue the official death certificate that can be used for burial purposes, for inheritance, and whatever it's used for. And then there was also a Form C that was issued, and this Form C was sent to the civil registry. This is for statistical purpose, that the civil registry can then register this person in their official records as someone who have passed away. And this was also sent to the Bureau of Public Health for official public health coding, so that we can get this information. And as you can imagine, with this being manual, with 2 separate forms being completed, there were room for errors and for delay, because they depend on how fast that the family member, or how fast the Form C is being sent to the civil registry and then to the Bureau of Public Health. So a lot of times you have Form C being sent to the civil registry, but take a long time before it is then conveyed to the Bureau of Public Health. But the new interface now with the new digital system, the data flow is significantly reduced. It is all digital. So when someone passes away, you go into the electronic system, into the app, and you enter this information, and it is sent directly to the Bureau of Public Health, the BOG, where they do their data assessment and their data analysis. But it is also sent at the same time to the civil registry. And so the civil registry prepares the death certificate, and the family member just go to the civil registry and pick up that official death certificate that they of course need to bury their loved ones. And in some cases, sometimes you're required to get that death certificate in very short time for religious reason, maybe for 24 to 48 hours for burial purpose. And so with this digital system, it speeds up the process instead of having to wait and the delay from the manual system. So in the implementation of this, we faced numerous challenges. Like we know, for anything, there are challenges. The first form, which was the form that that the family will get. There is legislation that forces the family to physically take this form to the civil registry, and then the civil registry then issue the certificate, and that I mentioned earlier, that sometimes there can be delays in Form C. It didn't have any patient information, identifiable information. So if there was a back and forth, if there was an error that was made, this was the one that was sent solely for statistical purpose. It was very difficult to track the information, and so you have a loss of records. There were issues around accuracy. There were issues around the quality of mortality information, and so there were situations in which there were diseases that require laboratory confirmation, coroner's inquest, etc. That it was very difficult after time passed to a very tedious process to go back and get the information and match it to that cause of death. And so this really impacted on the quality and the completeness of mortality data for Suriname. And so the key elements of this new digital death certificate for Suriname is that it ensures user integrity, and the chain of events have been completely improved, have been completely streamlined, have been made easier for the user, especially physicians who do have limited time and require, don't have a lot of time and don't spend sufficient time in accurately filling in this death certificate. This helps to improve through link with ICD-11, through search, where they can actually search and be able to enter accurate data instead of just something subjective that they think is a cause of death, entering things like natural causes, dying from old age, and things that realistically do not exist. If it's not in there in ICD-11, they cannot enter it. So then when they try to look for that, it's not there, they will actually have to look for an accurate cause of death. And so this help in improving the quality of data. So some of the advantages that we've seen in Suriname in terms of the implementation of the electronic death certificate is that it has helped us in the standardization and the quality of the data, ensuring consistency and accurate data collection, leading to better statistics and even easier reporting. It's the accessibility and retrieval. Before, all of these were paper-based, being stored not in proper form, and so sometimes if you need to go back retrospectively and look for a death certificate, it will be impossible. But now the records are electronic, and so retrieving these records is easy, as you know, is by a click, and you can find these records. Security and privacy, with it moving online, it has enhanced security measures to protect sensitive information from unauthorized access and tampering. Error reduction, again, as I mentioned earlier, with it being electronic, it has really helped in reducing errors. Integration with other systems, the country is in the process of doing the electronic medical record, and so with other systems, especially the civil registry, hospital, etc. We've been pushing for greater integration so that it makes the work easier and it prevents the duplication of the entry of information, and it even speeds up in terms of the flow of information from facilities, from hospitals to the central registry, and to the police and other agencies. In terms of disaster recovery, again, with the electronic record, we know with disaster, paper can disappear easily, and so with this information being stored on server or backed up to the cloud, then that will not really be a significant issue. And then finally, in terms of international standardization, it facilitates compliance with international standardization and regulations, making it easier to handle cross-border legal and administrative matters, and also really being tied to ICD-11. But all of this was not easy. Of course, we had challenges in terms of interministerial collaboration. As you know, it's just not Ministry of Health, it's not just hospitals, not just the Bureau of Public Health. The civil registry is a critical part of this process, and civil registration falls under a different ministry, that is the Ministry of Internal Affairs. So we had to ensure that we got everyone on board, discuss with them that, as Ministry of Health, that we were interested in moving in this direction, in digitalizing the death certificate, and what implication it will have for the civil registry, and how could they be part of this dialogue, this discussion, and this transformation. Secondly, like I said, mortality coding is now done in ICD-11. And so it required training to support this transition, moving from ICD-10 to ICD-11. And it is something that we're still in the process of doing. PAHO, WHO supporting training, working with RIVM and other agencies, CARFA, to support the transitioning from ICD-10 to ICD-11. Of course, there were challenges in getting the digital system on the Google store and on the Apple store. But we did overcome these challenges because, of course, the IT part of it do present some challenge. And so physicians don't have to just sit at a computer using a tablet, using their cell phone. They can go directly into the death certificate and complete that death certificate. So we wanted to really make it at the tip of the physicians, and at the fingertip of the physicians and the users, and then getting acceptance and buy-in by the users was very challenging. We had to listen to all of the users. We had to listen to their concern why move from paper-based to a digital format, and really see how we could address all of this before they were willing to support the process. And even so, when we implemented it, as they started to use the system, there were challenges, and we still have to, change and make the appropriate changes along the way to optimize it so that everyone is comfortable in using the system. So thank you very much, and that's the experience from Suriname. Thank you, Mina. Over.
Thank you very much, Rasmond, and I want to thank all of you who stayed, because I know we've gone a little bit over the time, and I want to beg you to stay a couple minutes more, because we have done much, have progressed a lot, and many good things are coming. But in order to progress more, it is important not to work alone. That's why one of the purposes of this meeting, and I forgot to mention that at the beginning, was also to invite you to the launch and to become a part of a practice community that we want to put together for the digital transformation of ICDs 10 to 11 in Latin America and the Caribbean. So the idea is that everybody who has registered can be a part of this community, join this community. That I'm not going to tell you that you work in this setting for many years. This civil registry and vital statistics records are important to be put together with the information systems for healthcare and their maturity. We know about the needs, and it was said by everybody who was talking today. And we know that these are deficiency and with the identification of the constraints, the interoperability, the gaps, interoperability of systems, the idea we have and that we propose in this group is to put together a practice community that can, with this group of people that share the same passion for the topics, to be able to share best practices, to be able to develop some products for the region because nobody else but those that work with this are interested in this to know what are the needs and priorities. This practice community always has the approach to go toward digital transformation. This team will have several objectives, and once you're registered, alas, Maria Lidia and Victor Hugo have been working a lot on this to put together all this proposal to share here in the chat. What's the link to register? If you want to access right now, perfect. Otherwise, after this meeting, we'll send an email to those that have enrolled to invite you to be a part of this practice community. As with everything, as with every practice community, you start by registering and then you put together a proposal by the coordinators, validated by the members. And the registration form, you'll be able to see these topics, which we've identified as parameters, ICD-10 systems, and we're going to ask you to prioritize them according to your needs and knowledge, and then we'll be able to schedule some activities toward the future, which will be executive meetings, such as a launch when everybody is registered, uh, team meetings when we have identified products that the practice community would want to or can develop, and webinars, meetings with experts to be able to develop some particular topics. We found in the Q&A session that you asked for some specifics, and we're also going to consider that for the activities that will be held further later on. So the idea is we've already uh, proposed this practice community. We expect to have uh, a meeting in 2 or 3 weeks as a kickoff meeting. So the invitation is that those we've invited to this activity will be there, and we'll also talk to our focal points to check if we have a representation from all countries, and also to invite those that have not been with us today. We will have a website, and we also have an extranet bar to be able to share a product, the recordings of our webinars, to be able to also share the videos as you've asked for, etc. Also, well, then we're going to have an insert to send our communications via our website. So quickly now, and once again, I thank you for having stayed all the way to this last minute. So you're all invited. We'll shortly be sending the invitation. And so now, on behalf of the team, and on behalf of Marcelo D'Agostino, as I said earlier, we really thank you for your interest, for your participation, for your questions, which we've been giving answer to in chat, and some of them will continue debating about later on. And we wish you all to have a wonderful weekend, and also my gratitude to all our speakers. So thank you all very much.